Hello, this is Dr. Tom Clark from the Center for Weight Loss Success. I'm a board-certified bariatrician as well as weight loss surgeon. And over the past 2 decades, I've helped thousands of people lose weight and keep it off for life. Now, one of the more common questions that I get concerning weight loss surgery is, how do I know if I qualify for weight loss surgery? Very good question. Let's see if we can put some answers to this. Now, just some generalities here. If weight is impacting your life or your health, you may be a candidate for weight loss surgery. Now, that doesn't mean we operate on people trying to lose 20 pounds, but on the other hand, often insurance companies want you to wait so long till you're so overweight or you have so many medical problems that it's really impacting your life and shortening your life. Therefore, it makes no sense to me to actually wait that long. But most insurance companies follow the National Institutes of Health guidelines, and this is based on body mass index as well as other health problems. So let's go into that a little more depth. Now, body mass index, what is it? BMI, or body mass index, you'll see this term thrown a lot in your research and your reading, but body mass index basically takes your height into consideration when we just talk about weight. So it's a mathematical equation. It's basically your weight in kilograms divided by your height in meters squared. So it basically takes your height into consideration. Now, they looked at body mass index over the years, and they get divided into certain categories there. Body mass index of 18 to 25 is considered normal. A body mass index of 25 to 30 is considered overweight. Body mass index of 30 to 35 is kind of the definition of obesity. And a body mass index of 35 to 40 is what we refer to as severe obesity. And here's where people may become candidates for surgery. And body mass index of 40 or more is what we often refer to as morbid obesity. Now, the word morbid sounds terrible, but what the word morbid actually means is diseased. And what that really indicates then is the weight itself is actually considered its own disease process then. Now, the reason the body mass index is so important is that there's a direct correlation between BMI and health risk. So the higher your BMI, typically the higher your health risk. And that's why insurance companies look at this specifically. All right, so what are the guidelines that the NIH throws out there? Okay, so these NIH guidelines, every insurance company has their own guidelines and variables, but in general, you're a candidate for weight loss surgery if your body mass index is 40 or more. Now, body mass index of 40 is typically around 100 pounds overweight. Okay, so you may be completely healthy otherwise, but just with your body mass index, if it's 40 or more, you're a candidate for surgery. Or if your body mass index is 35 to 39, or basically 35 to 40, with significant medical problems. And most insurance companies are looking for, when they say significant medical problems, diabetes, high blood pressure, sleep apnea. Those are kind of the big 3. They may throw in a couple other ones, but those are kind of the big 3 that most of them are looking at. So if you have body mass index of 35 with these comorbidities, you're also a candidate for surgery. Now, what's my take on this whole thing? Kind of going back to the beginning here, basically it's your decision, and it needs to be a right decision for you, not just based on body mass index. It really depends on your mindset and your motivation. So whether you are a candidate for surgery really is dependent on what do you want. What is your motivation? So you need to do it for yourself, not anyone else. Not because, gee, my doctor told me I should think about it, or because, gee, my family thinks I should think about it, or anyone else. It needs to be you. It needs to be your decision, right mindset, right motivation. What's my recommendation? Well, don't necessarily let an insurance company determine what is right for you. Yes, they can help you with these guidelines here, and again, but it's still your decision. You want more? Okay, we'll give you more. If you'd like to receive 21 free videos on the top questions you need to ask when considering weight loss surgery, please go to this website, www.myweightlosssurgerysuccess.com. Or if you're just interested in more about our Center for Weight Loss Success, go to our corporate website, which is www.cfwls. Try that again, cfwls.com. We'll see you on the next video. Take care.